All right, welcome. Today we are going to get into one of the most foundational skills in our entire clinical toolkit, how to identify and work with your patient's emotions in CBT. Honestly, getting this right is what separates the good therapists from the ones who create real lasting change. So before we even touch on technique, let's start with a really crucial idea. A lot of people, and even some of our patients, think the goal of therapy is to just stop feeling bad. But that's not it at all. Distress, anxiety, sadness, they're not the enemy. They're data. They're like physical pain, a signal that something needs our attention. So our job isn't to eliminate these feelings, it's to help our patients understand them.
Here's our roadmap for this explainer. First, we'll talk about why emotions are the absolute bedrock of this work. Then, we'll nail down the single most important distinction you need to teach, that thoughts are not feelings. From there, we'll get practical, how to name emotions and rate how strong they are. And finally, we'll tie it all together to see how you can use this to guide an entire session.
Okay, let's dive right in. Why do we put so much focus on emotion right from the get-go?
This is just a non-negotiable part of the work. The patient's feeling, whatever it is always valid, period. We never, ever challenge the feeling itself. Our job, the real therapeutic work, is to look at the thoughts that are driving that feeling. When you validate the emotion, you build trust, you build that alliance, and you create a safe space to start examining the thoughts.
Now this brings us to what's probably the most common point of confusion you'll see with your patients, and it's the most vital distinction we need to help them make.
We have to start with a shared language, and for our purposes, an emotion, a feeling, is a one-word label. Sad, angry, anxious. It sounds simple, but it's all about creating clarity. That one word becomes an anchor for the patient. It helps them take this big, messy internal experience and boil it down to something we can actually work with.
And then we introduce automatic thoughts. And these are totally different. These aren't feelings, they're the ideas, the little bits of language or the images that just pop into our heads. It's that constant stream of consciousness that, as we know, is the fuel for our emotions.
This slide right here, this is the whole ball game. Thoughts, like I'm a failure, are basically just hypotheses. We can investigate them. We can question them. We can put them on trial. But feelings, like sad, are experiences. We just accept them. We validate them. You investigate the thoughts, you validate the feelings. That is the core of it.
And you're going to hear this kind of thing all the time. A patient will say, I was feeling like, and then what comes next is a thought, not a feeling. It's no use. That's a classic example of thoughts and feelings being all mushed together. And our job is to help them gently pull those two things apart.
And this is the masterful intervention. Notice what the therapist does. They don't say, nope, that's a thought. They validate. Those are important thoughts. And then they pivot. It becomes a small, collaborative teaching moment. It's not about correcting the patient. It's about clarifying things together.
And there you have it, the payoff. The therapist gently guides them back to the moment and asks for that one-word emotion. And the patient finds it, sad. Now we've separated the thought, it's no use, from the feeling, sad. That is a huge step forward in a session.
Okay, so once we've teased apart the thoughts from the feelings, the next job is to get even more specific about the feelings themselves. And this is more than just a labeling exercise, it's a key part of our diagnostic process. This is exactly why getting specific matters so much. Think of the emotion as a giant signpost. It points you directly to the kind of thought you should be looking for. If the feeling is anxiety, you start looking for thoughts about future threat. If the feeling is sadness, you look for thoughts about loss. The emotion is your clue.
You know, for patients who find this tricky, a simple chart like this can be a fantastic tool. You can build it with them right there in the session. You just map specific situations to the emotions they felt. It gives them something concrete to work with and really helps build up their emotional literacy.
And sometimes, honestly, the problem is just vocabulary. A lot of people walk around with maybe 3 or 4 words for their feelings: mad, sad, glad, and scared. Just giving them a list like this can be a complete game changer. It gives them the words they need to describe their inner world with more precision.
Okay, so now that we can put a name to the feeling, we're going to add another layer. We're going to quantify it. Now, this might sound a little clinical, but trust me, it is incredibly powerful.
Just asking this one simple question, how sad, is a huge deal. It immediately breaks the patient out of that black and white all or nothing thinking.
It's not just I'm anxious or I'm not anxious. It's a spectrum, and that helps them see that emotions change. They go up and down, which is crucial for tracking progress.
Our classic go-to tool for this is the 0 to 100% scale. The key is to anchor it correctly. You've got to explain that 0% means you're not feeling it at all, and 100% is the absolute most intense you could ever imagine feeling that emotion. That gives you a consistent way to measure things week to week.
But of course, you're going to have patients who just don't click with numbers, and that's fine. A good clinician is always flexible. If the 0 to 100 scale isn't working, just pivot. Offer simple words. Was it a little bit sad, a medium amount, or a whole lot? If they're still stuck, you can even just draw a line on a piece of paper and ask them to point. The method doesn't matter as much as getting a sense of the intensity.
So now, let's put all the pieces together. This is where the rubber meets the road, where these skills really start to make your sessions more focused and, frankly, more effective.
That intensity rating you get from the patient, that's your compass for the session. It tells you where the most important work is. A problem that gets a 75% anxiety rating is a much better use of your time than a 25% annoyance. You go where the heat is, because that's where the core beliefs are most active.
So think about this common scenario. Your patient starts telling you about a problem they had. Your very first move shouldn't be to get all the details of the story. Your first move should be to take the emotional temperature. Okay, so how bad did you feel on that 0 to 100 scale?
And here is the beautiful clinical move. The patient says, maybe 25%. Instantly, the therapist knows this isn't the main event. So instead of going down a rabbit hole for 20 minutes, they can skillfully redirect. Okay, so that one wasn't a huge deal. Was there another time this week that felt much worse? This is how you keep therapy potent and on track. So there you have it. These are the tools. They're not flashy, they're not complicated, but their power is in how you apply them. They give you a clear structure to navigate that messy, chaotic inner world of your patients and turn it into a roadmap for change. So the real question is for you. With these tools in hand, which of your patients' distress are you going to clarify first?